Why is it important to rule out stroke mimics for mini-stroke symptoms? Imagine feeling sudden weakness or numbness on one side of your body, or having trouble speaking clearly. These signs can be scary and often point to a mini-stroke, also called a transient ischemic attack. But sometimes, these symptoms are caused by other conditions that look like a stroke. That's why it's so important to carefully figure out what's really going on before jumping to conclusions. A mini-stroke happens when blood flow to part of the brain is temporarily blocked. Symptoms usually come on suddenly and resolve within minutes or hours. Even though they go away, a mini-stroke is a serious warning sign that a full stroke might happen soon. Quick diagnosis and treatment are crucial to prevent permanent brain damage. However, not all symptoms that seem like a stroke are actually caused by blood flow problems. Conditions like seizures, migraines, low or high blood sugar, infections, or even certain neurological or metabolic disorders can mimic stroke symptoms. These are called stroke mimics. They can produce similar signs, but they are caused by different issues that need different treatments. Why is ruling out these mimics so vital? First, because the treatments for true strokes are powerful and carry risks. For example, clot-busting drugs can save lives but can also cause bleeding in the brain if used inappropriately. If someone is given these drugs when they don't actually have a stroke, it can cause serious harm. Second, misdiagnosing a mimic as a stroke can mean missing the real problem. For instance, if a seizure or infection is overlooked, the underlying condition might worsen without proper treatment. This could lead to more health problems down the line. Third, unnecessary hospital stays and testing can be costly and stressful. Patients might be admitted to stroke units and undergo extensive scans, which may not be needed if the symptoms are caused by something else. Accurate diagnosis helps avoid these unnecessary procedures. Fourth, proper identification guides follow-up care. If it's a true mini-stroke, the focus is on preventing future strokes by managing risk factors like high blood pressure or cholesterol. If it's a mimic, the treatment plan is different and tailored to the actual cause. Finally, correctly diagnosing and treating the right condition improves patient outcomes. It reduces the chance of complications and helps patients recover more fully. Recognizing stroke mimics ensures that each person gets the safest and most effective care possible. In summary, ruling out stroke mimics in patients with mini-stroke symptoms is essential. It protects patients from unnecessary risks, ensures they get the right treatment, and helps prevent future health issues. Always remember, if you or someone you know experiences sudden neurological symptoms, seeking immediate medical attention is the best step. Only healthcare professionals can accurately diagnose and provide the appropriate care.